is Karnataka. In a moment, I'll be joined by three doctors. Let me introduce them to you and let them hear this story first. Dr. Randeep Guleria, All India Institute of Medical Sciences Director, is with us. Also with us is Dr. K. Srinath Reddy of the Public Health Foundation of India and Dr. Devi Shetty. These are three of the country's top doctors. I'm coming to you, gentlemen, in a moment, but I want you to see this story from Karnataka because the state wants the maximum restrictions to be lifted. It wants gyms, golf courses and salons to open from Monday if the centre gives the go-ahead. Take a look.
Come May the 18th, fitness freaks in Bengaluru are hoping they can go to gyms and golfers can do the rounds of the links. The Karnataka government is, however, being guarded. It's waiting for the Home Ministry's fresh guidelines on Lockdown 4.0 before it announces the opening of gyms.
The zoning of red zone should be removed. Only the activity should be restricted only in containment areas. Other than the containment area, all other areas, we need to allow the activities to happen, not in any limitation or restriction.
Earlier, the state government had decided to reopen gyms and golf courses after a delegation met Chief Minister B.S. Yediyurappa, urging him to look into the plight of gym owners and trainers who are losing their only source of income.
It's been really a hard time for our fitness industry. From past 2 months, it's lockdown. So all gym owners and trainers, we suffered a lot. So I request all the gym owners to please follow the guidelines and take care to prevent this COVID-19.
If the Home Ministry allows, Karnataka's government is considering opening of restaurants and salons with strict preconditions. Many restaurants are willing to open their dining sections with just 30% of clients.
We will ensure to take necessary precautions like hygienic, maintaining social distances and other things also. We will issue guidelines to all our hoteliers to take extra care of cleanliness and to serve quality and hot food.
After the 17th of May, the state may well see a resumption of some services to help out small neighborhood businesses.
This is one aspect of Karnataka where supermarkets are working completely well and fine, and the other sectors that are opening up right now is the tech industry, IT/BT industry. Karnataka government has allowed them to work with minimal force, and gyms and golf courses have been allowed. But depending on MHA guidelines in the next few days, Karnataka government is set to ease off relaxations in terms of marriages, in terms of saloons, restaurants, dine-in restaurants. These are some relaxation the Karnataka government is hoping for. But at this point of time, all essential supply is completely in and supermarkets are working well and fine. Nagarjun Dwarkanath for India Today.
So what can we expect come the 18th of May? What should we do in terms of safety dealing with once the restrictions are slowly open? Exit Plan 1.0. Joining me now, as I said, Dr. Guleria, Dr. Devi Shetty, and I'm also joined by Dr. K. Srinath Reddy. Appreciate all of you joining us. My first question, Dr. Guleria, is the big one. Should the strict measures from now on only be in containment zones? That the rest of the green and orange zones need to see a widespread range of activities?
So I think the important question is that if we allow the green or the other areas to have widespread activities, it has to come with a rider, and that rider is that the infection control measures have to be in place and people have to really respect that. So whether it is social distancing, whether it is hand washing, whether it's wearing a mask, those become very, very important, because if they are not followed, then the virus gets a chance to really come back. There will be a resurgence of the viral infections, and we will see more and more cases even in these areas. So I think although there is a need to really see how we can gradually lift the lockdown, especially in areas where the cases are declining or are very less, the so-called green zones, it's very important that we also monitor them carefully. There is aggressive testing, contact tracing and isolation done, so that even if there are a few cases, they are not allowed to spread the disease in these areas where you will ease the lockdown. And there has to be a citizen responsibility so that they take all these measures so that the chain of transmission is broken or does not happen in these areas. These are essential things if we are looking at lifting the lockdown in that area.
You know, Dr. K. Srinath Reddy, there are some articles that are coming in at the moment that in determining what is a containment zone and what is not, the data is incomplete. ICMR doesn't have full data. And what we are now finding in number of green zones like Goa suddenly have cases and they will come into the orange zone. Udupi, parts of Bihar, Odisha as rural migrants come back. Can we have a very clear color-coded map of India where the focus is now only on the containment zones after the 18th? Is that possible?
Obviously, every single zone has to be clearly monitored, even as we try and ease back into normalcy as much as possible. There has to be a decentralized, differentiated response, and that requires careful monitoring as well. The monitoring is through syndromic surveillance of influenza-like illness and, of course, of serious acute respiratory infections with testing as per indications. If we find that a particular zone is increasing by 40% of cases, then obviously that has to move to a red zone or a containment zone. If it is consistently showing a less than 40% decrease in the cases, then we can actually ease up the restrictions. So having real-time data is very critical for making these judgments. But whatever is done is to be done at the local level with appropriate people participation, both in surveillance as well as in containment. And that's the one way we can actually, with citizen volunteers as well, helping the primary healthcare system, that we can get much better real-time estimates.
The reason I'm asking also Dr. Devi Shetty this is you've also come out and said that the lockdown must go. But in a Bengaluru, for example, do you only focus on the containment zones within, or do you declare the entire city in a sense as a red zone? That's what's happened in Delhi, for example. The entire city is a red zone. Has the time come, as Arvind Kejriwal is suggesting, for example, in Delhi, we will only focus on containment zones, allow economic activity to resume in the rest of the city?
We have to have a slightly differentiated response. But having said that, we must be aware that areas which were very, very green and no cases, with the opening of economy, there will be some cases. We must be mentally prepared for resurgence of the infection. The question is, when it happens, how well we test it and quarantine. And looking at state of affair in Karnataka, the number is so low that even if it goes up or doubles, still we can manage. It is within the manageable means. These are all very dynamic reactions. So which we have to, and Karnataka has a very good way of monitoring on a district level basis with all these software technologies what they have developed. Government has done a tremendous job in Karnataka in containing the COVID spread, and I expect them to continue to do so.
So you're saying focus only on the containment zones. My next question, which is being put, Dr. Guleria, is what the Maharashtra government has said. They are saying, should local train, they want local trains and buses to be opened for essential services. Now, once you open the local trains in a city like Mumbai, then really that is Mumbai's lifeline. And how will you then stop large numbers of people from entering trains is one concern. But on the other hand, without the train services, you can't really resume economic activity. What's your view? Should public transport now start in our cities or not?
So it's a catch-22 situation, but I do agree that for economic revival, public transport is essential, especially in cities like Metro or Delhi, because there's no way that you could have people going to offices or work or to business unless you have these things working. The challenge is to do it in a way that you can minimize the chance of spread of infection. And so social distancing, decreasing the number of people who can get into one carriage become very, very important. And responsibility of people in terms of how they travel and how we can have a graded response, that is the timings can vary so that there is no one office hour crowd, but it can be at a differential time, so that there is people coming in at different times, and therefore
So you're saying have public transport can resume, but with staggered time. Let's say the metro, for example, in Delhi, or the local trains in Mumbai. Is that what you're saying? Change the timings, have protocols, but don't not resume it. It's time to resume them. Am I correct?
Correct. With good infection control measures and social distancing.
With good infection control and social distancing. So that's an important point. Remember, all of these experts are being consulted by government, so they are really people who know what they are talking about. I want to come to you, Dr. Reddy, now. Should low-risk groups move freely? Many people are saying that those who are low risk, particularly in the working age group of 18 to 40, they should be allowed to go out more freely. Do you agree with that?
They should certainly be more mobile, but with all the precautions taken. Obviously, what we are saying about physical distancing as well as hand hygiene and wearing masks is important for them not to get infected and come back and transmit infection to the older people at home. Therefore, while their mobility need not be restricted, their behavioral changes have to be still maintained as a matter of abundant caution.
You know, it's an interesting way you're putting it, because the moment you have people going out in large numbers, they could well get infected. Let me therefore raise the next question with you, Dr. Shetty. Should senior citizens stay at home at all costs? There are countries at the moment which are saying in their exit plans, asking senior citizens stay at home, even as the working age population is being encouraged slowly to go out. Do you agree with that?
I agree with that point entirely, and that's the best thing we can do to reduce the mortality. Now, our effort should be to reduce the mortality and morbidity, and senior citizens are most vulnerable, and every measure has to be taken to they are protected in a very safe place, and all their requirements like medicine, food, everything is supplied, and they should not go out of the house to busy places.
So any exit plan does not involve senior citizens. Am I correct?
No, they are very vulnerable and they should be controlled. They should be contained. Yes.
I started off, Dr. Guleria, with a story on how Karnataka wants to push ahead with opening up barber shops and gyms. How safe are barber shops? Because Kerala asked for it in the early part of May and the centre rejected it. Do you believe the time has come, with social distancing, with safety protocols, to open up barber shops and gyms?
So again, barber shops are one area where there is a close contact, and therefore one needs to be extra careful. Again, protocols need to be put in place so that infection control measures are there, whether it be wearing a mask or whether it be using some gear so that there is no transmission of infection. Keeping that, barber shops could be open and gyms could also be open. But like I said, the basic premise is that people follow the infection control measures sincerely and are able to do that when they go out, so that they don't transmit the infection or get infected.
I want you to hold on to those thoughts, because I just want to play a story which I think you will find interesting, because this is a big question, doctors, that is coming up. Air travel. Many of us, feel almost restricted without air travel. Take a look at what is happening in Kolkata, and then we'll come back to our doctors. This is what Manogya Loigwal is reporting.
Desperate times demand desperate measures. Airline industry hit hard due to lockdown is now working on war footing to ensure COVID-safe travel. India today went on ground zero to check airport preparedness. Step 1. Disinfecting passenger and luggage.
The first step that would be followed is the spraying of disinfectant on the luggage that every person enters with. Next would be use of sanitizers on your hands as you enter this. But that's not all. There will be a further checks also at the entrance.
Step 2. Temperature check.
Any entrance will have a distance maintaining as well as the temperature check of any person who enters at the airport. Allowing after this, what next?
Step 3. ID check.
This is the next process that will be followed. That means there will be a machine that will be used as a scanner here. The scanning machine will take your ID cards. You will also have to, I've been asked to open the mask also. so that they know that this is the same person that is showing in the ID card. And with that, as I should also remove the mask to ensure and confirm to the CISF officials that this is the same passenger who has the ticket and the ID card who will be entering the airport.
Step 4, boarding pass collection.
Any person who comes, he has to stand in a queue at this distance and then walk up to these counters. Walking up to these counters means not touching them, showing your mobile phone or your ticket with your ID card, and then collecting the ticket. So any person who is operating the kiosk will be only one person identified from the airline.
Step 5, luggage drop.
These counters are the ones which will have again maintenance of social distancing here. That means that there will be a distance of at every counter as soon as you walk in. There will be a screen like this that would have been made by then, with only one of the two counters operating to ensure that the social distancing norm is not flouted. As you show the ID card, you show your ticket, you collect, you just drop in your luggage.
Step 6, security check.
If a passenger comes in after collecting his boarding pass, he will have to show it from a certain distance to the CISF official and then walk in further. There is, of course, a maintenance of ensuring an absolute foolproof process here too. Washing of hands with these automated machines. Even the person who's keeping his entire personal belongings in the tray will have to ensure that it is an absolute contactless process here too. There would be a next operation. That means every person will be frisked, but with a difference. I'm Anogya Loiwal bringing you exclusive details on every development related to airport and what would be the next new normal for the next flights in operation, only on India Today.
Let's raise the next question then to our doctor panel. Is air travel a risk? Many are saying, many state governments believe that you need, the center also believes some form of air travel. Is it a risk, Dr. Reddy?
Well, let's first get our objective straight. Our intent is to slow down the rate of transmission and reduce the speed of infections. But we can't completely avoid it, whether it's young or the air traveler. Often they're the same. Most important objective is to reduce the deaths, and therefore we are trying to slow down the rate of infection and create a bumpy road for the virus to travel. Travel it will, but we must slow it down. And air travel can certainly be made much safer. We don't have to completely stop air travel. We have to resume communications, but obviously for essential needs, unnecessary leisure travel can be restricted for some time, but air travel can be made as safe as possible.
Right.
And we can actually ensure that the amount of virus dissemination is reduced as much as possible.
One of the other proposals which has come, Dr. Guleria, and this is my next question, is time to open malls on alternate days. The Delhi government is saying let's open malls and markets on alternate days. So like you have staggered transport, also have staggered services through malls and markets. Is that something you think can be done post 18th May?
So again, in areas where the infection rate is not very high, strategies like this can be looked at by looking at measures that we are making sure that there is no resurgence, we are able to prevent the transmission of disease, and there is no overcrowding. So even if you open some shops, if social distancing is maintained, if we are able to have good cleaning of surfaces so that there is no transmission of infection, and people are careful about wearing masks, then to a limited extent, some shops in a shopping mall can be open, but we will have to have a real check in terms of the number of people who can enter depending upon the capacity.
You know, the worry, of course, in all of this, Dr. Shetty, is that once you open things up, very difficult to control. You know, once you open up markets, once you open up malls, people will come. They are feeling at the moment fatigued almost with the lockdown. Do you believe also that it's time to look at new innovative ways of opening up markets and indeed public spaces?
These days, because of the security reasons of the past, there are methodologies to control the crowd. Generally, these shopping malls have only one entrance, where there are enough security guards already there to control the numbers, and they also know how many people have entered. So it is not difficult these days to control the number of people who enter the mall. So one of the best way is to keep the mall open for long hours, start early morning, close it very late night, so that people do not need to rush because it's open only for a limited hours.
Okay.
So by extending the hours of business, we can actually reduce the crowd.
You know, we saw, of course, with liquor shops, the crowds just thronged the moment the liquor shops were open. Hopefully, malls are different. But Dr. Reddy, the question is, open spaces, are they safer than closed spaces like offices? Linked to that is the question of air conditioners. Because many believe that you're much safer, actually, when you're outside in a public park, where at the moment people are often not allowed in certain parts of the country, than when you are in a closed space like office. Should offices be open? And if offices are open in air-conditioned environments, should there again be restrictions and protocols?
Well, open spaces are certainly far better, particularly if you can maintain adequate physical distancing for even those who are exercising or walking in the open spaces. But certainly closed offices can be a problem. We can actually increase the amount of working from home so that we reduce the number of people within an office. But certainly ensuring that people who are obviously having some signs of infection, cough or sore throat or fever, or all of them are screened and not permitted to work in an office environment. And within an office itself, you can take a lot of precautions. Like you can actually plan not only the seating arrangement, but even the movement within the office in a precisely predefined clockwise manner or something like that, so that people don't bump into each other. Air conditioning, if it becomes necessary in an office and you can't overnight change the office architecture, it can be used. But obviously, we have to be very careful about wearing a mask and ensuring that whatever virus may be possibly circulating is filtered out.
Let's raise the question, though, that is troubling Dr. Guleria, is there a possibility of a second wave? You know, you were quoted as saying, look, at the end of the day, the worst is still to come. It could come in June, July. Other countries, South Korea, Taiwan, China, are experiencing, according to some reports, a second wave. Is that a worry that the moment, let's say, we open up even a little bit more after the 18th, and we saw that when we opened up a little bit in early May, the number of cases spiked. Is that a fear, and is that a fear we should learn to live with?
So that is definitely a fear and a worry that we have, that there can be resurgence of cases or a spike in cases because of the travel that happens and the movement that happens. And that is why with this opening up of the travel and the movement or decreasing the lockdown comes the rider that you have to still be very vigilant in terms of surveillance, in terms of infection control, and in terms of testing and isolating people who are turning out to be positive. So a defense mechanism or a strategy which is there needs also to be developed as we move forward, so that there is no resurgence of cases. There may be some increase in cases, but it should be to the extent that it is manageable as far as the health resources of the country are concerned, and also it should not lead to higher mortality.
How do you define the word, Dr. Guleria, manageable? What is that? You know, when we say live with the virus, what is manageable? Do you believe that this is a number? How do you define that word manageable?
So the manageable part is two factors. One is that it should not cause a huge strain on health resources so that you run out of ICU beds or you have no place to admit sick patients. So that level should not be breached. We should still have the capacity to manage all those patients who need to be admitted and to be hospitalized. Remember, more than 80% of the individuals would be asymptomatic or have mild symptoms and would not need hospitalization. And the second part of this is to be able to manage it in a manner that the mortality doesn't go up. We're able to keep our death rate to a low level, and we don't have a resurgence or increase in number of deaths. If that is done, then I think living with the virus is not going to be a big problem.
Should each state have its own containment strategy is my next question. Dr. Reddy, do you believe that's the approach? Decentralize it. A Karnataka will have a very different strategy, let's say to a Telangana, to a Maharashtra, to a Delhi, to any state. Each state should now be allowed to have its own containment strategy. Should we have are there far too many guidelines being imposed by the center?
It definitely has to be decentralized and differentiated to a district level, not even a state level. And within a district level, between urban and rural areas are more likely to be protected at the moment, and they need to continue to be protected. However, when we are talking about local data driving local decisions with people participation, I think that is the ideal solution. But we also have to recognize the pressures that the governments function under, often of trade interests and other interests. So we do need an active civil society engagement to make sure that the containment plans are not derailed by selected commercial interests. That's why you require a broad partnership making the decisions.
But are those rules transparent, sir?
People are important.
Sir, are those rules transparent? There's a report today in a newswire agency which suggests that, as I said earlier in the program, that there is no transparency in the decision making, that the data is flawed. Do you believe that? Or do you believe the data is robust enough for a district level officer to take such decisions?
There is no reason why we can't collect district level data, particularly through syndromic surveillance and appropriate testing methods which can be added on to that.
Okay.
There are places, whether it's in Kerala or Andhra Pradesh, where ward and village volunteers are able to periodically visit houses and find out who is having a fever-like symptom or cough or other symptoms of COVID or influenza-like illness. And then they are sympathetically reported and escorted for the health services, or the health services visit them.
Okay.
To get the local data in real time is not difficult if we actually decentralize and give enough authority to the local people. So what we need is people-partnered primary health care.
I think you're making a very important point, and this could be a way forward from the 18th of May, people-partnered public health care. How long should schools remain shut is a question that is being asked, Dr. Shetty, because you know, many people, there is no sign yet of schools being started. Forget about cinemas and entertainment and restaurants, although some parts of the world are even starting restaurants. What's your view? Do you believe that there must come a time when even schools must start with safety protocols?
Certainly. I think it's very difficult for us to make long-term projections. I think we should take 2 weeks at a time. Any strategy you make, you should be willing to relook at whatever decision you have taken. Schools, colleges must reopen, but I'm sure, like anybody else, this is not the right time. We should look at it every 2 weeks and see how things are. Then you take the call.
My final word, therefore, to you, Dr. Guleria, because you're part of the government's COVID task force, giving them a lot of advice. What's your sense? 18th of May, will life be very different from the way it is today on the 15th of May, or do you believe that I'm jumping the gun when I'm talking of opening up and calling it exit plan 1.0?
So in my mind, life will be different to some extent, but it's not that it's going to totally change from what we have right now. A lot of measures that we have will still have to continue, because we must remember that the virus is still there with us. It's not going away in the very near future, and we're going to have more and more cases. So we will need to have our strategies in place, whether it is testing, whether it's quarantine or isolation, and we will have to look at a differential approach as far as the hotspots are concerned, where I think the strategy will have to be more aggressive as compared to those areas which are having few cases or there's a significant decline in number of cases, where the strategy would be actually more liberal in my mind.
Very quickly also, Dr. Reddy, will life change, you believe? Should it change from the 18th of May?
Well, it will change over a period of time, but not a sudden release back into the old normal, as they say. But it will certainly change, I believe, with the resumption of number of our economic and social activities, but with a careful vigil on our public health interests.
Okay. Gentlemen, as always, it's a pleasure talking to three top doctors, because there's no noise. There's lots of information, and I think all of you have given reassuring messages in difficult times. There are no magic bullet solutions, as you put it, but we have to gradually open up and perhaps take our chances. Dr. Shetty, Dr. Reddy, Dr. Guleria, thank you so much for joining us and informing our viewers with your perspectives.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.